Today's video is going to be on diet, exercise, and supplements during a frozen embryo transfer, or FET. Fertile embryo transfer is a lot to say, so I'm just going to say FET or transfer. Um, first, let's talk about diet, and just like with any fertility treatment and pregnancy itself, most doctors will recommend the Mediterranean diet to be the best option. Um, you don't want to change your diet right before transfer, so you want to start eating healthy at least 2 or 3 months before transfer, and it's best to eat a healthy pregnancy diet, but don't increase the calorie intake. You want to keep that the same. You may want to consult with your doctor or a dietitian um, as to how many calories you need a day. You don't need to increase your calorie intake until the second trimester, and you only want to increase it by 100 to 200 calories a day. And by the end of the third trimester, you should only be eating about 200 or 300 calories more than what you did pre-pregnancy. Fruits and veggies are all good. Just make sure you wash them before you eat them. So leafy greens, apples, bananas, oranges, lemons, berries, carrots, avocado, asparagus, beets, pomegranate. Lots of women will drink pomegranate juice right after transfer. Broccoli, cauliflower, sweet potatoes. A lot of Korean women swear by sweet potatoes, and Brussels sprouts. Whole wheat breads and pastas, brown or wild rice, lentils, legumes, chickpeas, quinoa, farro, beans, nuts, peanuts or peanut butter, seeds, pumpkin seeds especially, and we're right in the heart of pumpkin season, ginger and tofu, chicken and turkey breast, salmon, fatty fishes, seafood, eggs, full fat dairy such as milk, cheese, and Greek yogurt. Cook with olive oil, and also use olive oil instead of dressing on salads. And of course, drink plenty of water. Avoid alcohol, sushi, raw meat, raw fish, raw eggs, unpasteurized dairy, fast food, trans fat, high processed foods. So this includes frozen meals, even like a lean cuisine or healthy choice, chips, most breakfast cereals, packaged soup, ramen, energy drinks, frozen pizza, chicken nuggets, french fries, packaged cookies, syrups, jams, and salad dressing. Also avoid sausage, deli meats, and hot dogs. I don't eat very many of these things. The only thing I would maybe miss out of that is the frozen pizza and ramen. Limit caffeine to just 200 milligrams per day. That's 2 cups of coffee, or 3/4 of a can of soda. And what I mean by a cup of coffee, we're talking this kind of cup, not this kind. I don't drink coffee, so there's no problem there. I drink 1, maybe 2 mini cans of diet soda a week. But teas can have caffeine in it too, including green tea. Different teas can have different amounts of caffeine, so just read the caffeine content before consuming. I drink 1 cup of green tea in the morning, which is only 25 to 45 milligrams of caffeine. Also, no sugar or sweeteners in your tea or coffee. Use honey or lemon instead. High glycemic index foods such as white bread, white rice, and instant oatmeal kind of limit a little bit on that. Red meat, about once, no more than twice a week. So if you're craving a steak or a burger, make sure it's well done. Any fatty, sugary foods such as homemade cookies, cakes, pies, ice cream, donuts, candy. 1 donut a week's not going to hurt you. If you're a chocoholic, do dark chocolate instead of milk chocolate. Dark chocolate has some antioxidants in it. And here's some IVF food myths. pineapple, or specifically pineapple cores. Pineapple cores, they do have an enzyme that has an anti-inflammatory properties, but there's no evidence that this actually works. And eating too much pineapple is probably just going to upset your stomach. It's okay to have, but it's not going to make any difference if you eat it or not. Avoid gluten. Gluten doesn't harm fertility. This only affects people who have a gluten tolerance or a gluten deficiency. So if you don't have that, gluten is fine. Turmeric is a spice with an anti-inflammatory properties and is used in traditional medicines, but there's no evidence that works, and in fact too much of it can have the opposite effect. Avoid soy or soy-based products. Soy has phytoestrogens, which can impact your hormone levels, hence the word estrogen, which you need to conceive. So soy is actually beneficial to conceiving because it can boost estrogen levels, but only by a little amount. But sometimes a little boost is better than none. Another one is Brazil nuts. 1 or 2 a day is fine, but no more than that. Too much of that can have the opposite effect. And probably the worst myth of all times, eating McDonald's French fries right after the transfer. This myth started way back in the 90s, and to this day, I still see women posting selfies on Reddit and other IVF platforms of themselves eating McDonald's fries after their transfer. Even before I reached this, I was scratching my head at this, because if the doctors tell you to avoid high processed foods and fast food, why on earth would you think eating McDonald's fries would help improve your chances? Of course, when I researched this, every doctor's blog I read had the same reaction. They basically kind of roll their eyes or kind of shake their head in disbelief, as they have known and been telling patients that this is a myth for over 20 years, and yet women still do it. Most likely this myth started 30 years ago, because back then IVF was all fresh embryo transfers, and back then all the hormone medications would cause bloating. So they were told to eat something salty to kind of bring the bloating down. Kind of like, during your menstrual cycle, you tend to crave salt because of bloating. I sure as hell won't do this, but it must be the hormones, because these women go in as 30-something looking for medical assistance to help them get pregnant, and they come out sounding like teen girls willing to try anything, and I mean anything, to get knocked up. And I get it. IVF is hard. It's very expensive, and you want everything to work. The best chance you have is by following your doctor's orders and ask your doctor any questions or concerns you have. IVF is not a guarantee, but it can give you a better shot than trying year after year on your own.